amasomero agegabadde ndoza leading donors of blood, and I find that nti ebiseera ebisinga tamu teyinza kuggwako nga temukampinze ku masomero ag'enjawulo, being young bloods and all that. Nawe esanga nti amasomero gano sometimes gagenda mu holidays nga ate newe esanga aza okubawo crisis. So how does that affect blood donation?
So now first of all, I want to appreciate heads of schools. There are some schools, a few schools that, for lack of a better word, are difficult. They have difficult head teachers, directors. Some of them even within Mbale City. Whenever our teams go there, they don't allow us access the students. But most of the schools, 98% of the schools, allow us to access students. Their teachers mobilize for us students. In a special way, I want to thank the schools within Mbale City. They have been very, very, very cooperative. So, you know, when it comes to schools, abana bali younger, they are more energetic, they have time to listen to you a bit. Tebaina bizibu bya school fees, pressure, sukali, ate nayo mbeno omukazi, renti, so then they spare a bit of the time. Then, you know, it is easy to appeal to young people. Imagine tukola masomero. When we go to a school, tunonyayo abawala. Bawala babiri basatu, nga basaizi ntonotono. Now when they successfully donate blood, olaba ne na wete ma donating atenze. Kati oli abade ne natega, so like it is easy to appeal to young people as compared to the rest of us out there. Now, the strategy we have employed is that we know the school calendar. So towards the end of the term, we intensify blood collection. Gatumanya abana agenda kuwumula, and we shall need blood during the holidays. So Jukila Musai, depending on how we have prepared it, can do 35 days or 45 days expiry. The term is about 3 weeks holidays in Neza before, not the third term, first and second term holiday. So we intensify blood collection towards the end of the term. So to get holiday, now we have a good buffer stock of blood. Now, when we go into holidays, we know we are going down the difficult communities. Now, in the communities, the blood is not coming in as much, but it is topping up on the already existing stock. So by the time you finish the 3 days holiday, and now you go back to the schools and the situation further normalizes. Now that is the same strategy we are employing. Towards the holidays, you intensify. Collect a lot, you go back storage. As the holiday starts, you keep consuming gulio mukaddenga bamongerako. Graduating a holiday wedding ataba bakulachi bakoma ku masomero. And the beauty is that as a country we have very young people. We have the population is still very young. So we have a very big bulk to collect from. Let me give you an example. The other day we were in Mbale, and for 3 days we only worked on A level.
What?
Actually, Mbale this year has been the best donating school. For 3 days we only worked on A level. 3 days.
For 3 good solid
3 days. Nga tuyimirira. Era ekyagobyayo abantu bukuko abasawo babreedingana ne bakaga emigongo zifa. For 3 days we only worked on A level. They were extremely well organized.
Supply ya single demand.
No, the supply outweighed the capacity to collect it. So we really want to appreciate such schools. They were extremely well organized. You go to a school, you go to Mbale SES and they're extremely organized. You go to Kome SES, they give you a lot of support. Toro Girls School is also very excellent. The girls mobilize themselves, they line up very nicely. And even Nakoloka Islamic, Bilada Islamic, we've got some very good support from schools. So your strategy towards the holidays, we intensify to Banamunji, more holidays. Topping up, communities. We just top up little by little and manage to go through that period.
Chinkakasa luwabo lwadde abali lying entirely ku musaayi.
Yes.
All through their life.
Yes.
How does stock out in most cases affect them?
For example, kakati abalwadde abali ku dialysis, abalina endwadde z'ensigo, abalina kidney diseases, they need to survive on blood. They receive blood transfusion almost twice every month.
Wow.
or every time they are going to do a dialysis, they need blood. You should visit that dialysis unit, just one more regional referral hospital. So they cannot do without blood. Then when there is no blood, they just die. They just die. Omudia they not donating omusai should become a celebrity, should be recognized. Singa charge soboka. To in a wall of fame, you donate blood to catch financial. Maybe that's what we should actually do to celebrate these people.
Yeah.
Because they've actually saved lives. Some people purely depend on that blood. Abana by sickle cell anemia. They receive blood almost throughout their lives. So without the blood, they cannot survive. During the rainy season, during the rainy season when malaria is at its peak, baganda banga bagwere bakoja banga bebunyolya bona those belts is high malaria burden. They purely survive on blood. So it is very important for donate blood. Kakati here one bugisu. And with all due respect, to get a period of circumcision.
Yep.
To get a period of circumcision. There are some people who don't know how to do circumcision very well. So the boys who have been circumcised end up bleeding a lot. Either we are going to see, the moment the circumcision is launched, we are going to see an increase in demand of blood. It's an observation we have. Kakati, because of also what goes along with the happiness of Kadodi, Amasanyo, sometimes the violence, the accidents, we are going to see an increment in demand for blood. Either your period ya Kadodi, all those vices that could come with that period cause an increment in demand for blood. So it's a period we now know, we have a calendar to manage when this is happening like this. We have this challenge and we need to prepare ourselves for it. Yes.
Trends mu blood donation zibadde zitya naddala wano mu Eastern region naddala mu kaseera ka maternal health emergencies and I think even accidents and malaria and any other diseases. So
our observation is very clear that we have the lowest collections in May. We have the lowest collections in December and in January. May, late April, is mainly associated with agriculture.
Yep.
When it coincides the rains and coinciding with students going into holidays. You go to a trading center and you want to collect blood. And the people just look at you. They have their hoes, they have their pangas, and they have been doing their agriculture. So that period of late April, May, we see a reduction in the collection of blood. The other period which is significant is December, January. Because you call your Christmas and January related brokenness. December, people are traveling for Christmas. People don't want to do anything that risks their enjoyment of Christmas. Late December, for lack of a better word, people are either drinking or they are drunk or they are recovering from drinking. They are extremely very happy and excited. So they don't have time to donate blood. So December, the collections go very low. Now January, people are suffering from the enjoyment of December.
After effects.
Yeah, after effects of December. So even communities in January are different. You go talk to people to donate blood in January. I go to January. Suffering in a breakfast. You know, so we have a bit of challenges in December and January. So what we've innovated in December and January is we work harder and wider. Tosanga abantu banna mu kifo kye kimu nedda osanga abantu babiri nga banoonya omusaayi. Bwe tukwata kati gamba tukutte ekkubo lya Bugema obana babiri ku Toto, abalala n'obateeka ku checkpoint, abalala n'obateeka mu nkaaga ababiri, abalala n'obateeka wali ku mafuta side awo, abalala n'obateeka wali e Bugema. So that the two people you have put in one place may end up collecting 10 units over the whole day.
Wow.
But at the end of the day, you have 8 teams along that road and you have 80 units of blood. So we spread ourselves so thin. We try to reach out to as many people as possible. Dr. Bumba njagala gaba musaayi. tuli wane wange tuli abantu bana twagagaba omusaayi mujje tetujja tulina omusaayi naye mu January nga nomalo ngamba nti wanti oli wani namaguma muli babeka nti batano kanzijje so in January and December we are extremely mobile. We are extremely mobile. Then as we go deeper into the villages, people need to be appreciated. So we also come up with some recognition and awards that we actually give blood donors to try to motivate people. Kuvanga bo musayi sina chenali mfunya gaba nibonanga kembera sino nye certificate yiyo mbera kangale skiro ya sukali yogeno nyomo kachai mbere tabuse ababoda kale kankoyo lita ya mafuta. So we try to innovate in January kulaba we don't get into the crisis. So in January and December we work very hard. So I don't recover wave, but December and January, those are key defining moments. Yes.
Ayogede ku nsonga z'okugaba sukali na bikimu. Are those some of the strategies to put in place or encouraging abantu okwongera ogaba omusaayi? We don't even want to use such a strategy because also when people get used to awards, they become very difficult. Yeah. When people become used to awards, they become very difficult. You'll go back and they tell you, kule mwatu wa saboni wafaliwa. Mazoga wa saboni aliwa.
Saboni wafaliwa kwa mulide.
Wabalowoza bili part of Ugundi plan.
And yet it's not sustainable. Because as an example, if we do 4,000 units of blood every month here, if we are giving an award, even if it was of 5,000 shillings every month, that would be 20 million shillings in awards every month. It will not be possible to manage. It will not be able to sustain. So we only pick out particular communities, and when now it is too hard, we save lives. But it's not a strategy we want to encourage. Before, because UBTS was receiving money from the Americans some 7-8 years ago, t-shirts, capes, and things like that. T-shirt ya mitwale esatu. Kabema na abantu 10 nga bagala t-shirt emiliyoni 3 n'agajjawa. Ate yetu abantu abadonating omusaayi buli mwezi bali 14. So we always tell people, please donate blood because you want to save lives. Ebisigadde your reward is in heaven. Your reward is in heaven. When nagamba omusajja nangamba you go and get it for me from there. That's not to sakasira kakugenda mu ggulu. So it is a complicated thing. That's why we try to reserve it for only January, and when times are very hard. Actually, in January even the people who come here, even the refreshment changes. We have soda, water, juice. Nemu January noteka wa mata noteka na yogurt no yongera mu. So collecting blood can be very political. It can be very political.
In fact, your course is for political.
It can be very political. And then you have to do a bit of, you get closer to the people.
Yeah.
It's very difficult. Okuza mu January nga nyamba the tie. Kwa ndi man mu garage. Kati mu garage ya na mote tie. Yambala jidi ne t-shirt n'ogenda mu garage. Kakati January tubala abantu ba mipiira. Era we are happen to katakayengedde Super League. Kakati every time no be Super League game walugenda mu stadium nonya omusemba agezibwa omupiira. So in January we have to be extremely innovative and very mobile to have enough blood. Yes.
Maybe as we are coming to the closure of this engagement today, oyinayo obako obwenjawulo bali osindikira both abakozesa omusaayi, abagugaba, ababesigiriza okugaba n'abalala bonna.
Okay, so first of all is I want to say something about who is eligible to donate blood. Yep. Yes. Omuntu yenna ali above 17 years of age, they can consent. Kwanto omusaayi, we get blood from what we call voluntary non-remunerated blood donors. Mwenyine weewaayo ate tetukusasula. Amawanga mangi nnyo, they pay people to donate blood. Many countries. Abalala balina family replacement. And before you receive blood, you bring a family person to donate blood. But as a country, we have adopted the policy of voluntary non-remunerated blood donors. It should be that tukola nnyo okulaba omusaayi gubayo mu malwaliro. Gwe kasita ogenda mu ddwaliro ng'ogwetaaga, oba wali ogabyeko oba togabangako, oba you have a family member who has ever donated or not, you should find blood there. kakati so we get voluntary non-remunerated blood donors weewayo gaba omusaayi tekolaki tetukusasula. Now nti omuntu yenna ali above 17 years can donate blood. Ekyokubiri nti abasajja can donate blood after every 3 months, abakyala after every 4 months. Nga tonna gaba musaayi so netukebera obungi bw'omusaayi gw'olina. Okay, so omuntu yenna abasajja 13.5 about 2 measuring omusaayi in terms of grams per deciliter, so 13.5 grams. Abachala kasanga ali above 12.5 abasobola gaba omusaayi, 12.5 abachala, abasajja 13.5 okudda waggulu. So ndekebera obungi bw'omusaayi nikakasa nti olina okulaki ogukumala. Okuva awo tukwekennenya okulaba nti tolina ebirwadde ebirala bikulemesa kugaba musaayi. Singa tusanga you have any chronic illnesses tetusobola kukkiriza kugaba musaayi. N'embeera yo gy'olimu kwolwo olunaku is the most important. Walidde kamere bw'ojjanga enjala ekuluma tosobola kukkiriza kugaba musaayi. Bw'ojja mu January ng'enjala ekuluma tosooka kugulira kyamisana. Mu January kazajja ogamba osologa enjala ennuma nga mpitayo omwana wali ebagasadona mwe kamere alyoka donating omusaayi. So walidde kamere weewulira otya? Are you generally in good condition? Even just your mental state nga munnange mbeera ewaka eyo mama w'abaana yampisizaamu punch basewera bulungi na stressors nyingi, will not allow you to donate blood. So omuntu alina okuba nga ali generally healthy. Abantu, people who drink alcohol can donate blood. Naye abatamiivu they don't. Baba mutamiivu n'omwenge gumulabikako ku face, don't allow them to donate blood. Lwaki kigenda kukosa obulamu bwe? So tugezaako okulaba nti omuntu yenna ana donating omusaayi, their blood is safe but is also safe for them to donate. Kati singa tukusanga n'ogamba nti netukubuuza okola mulimu ki n'otugamba nze ntunda kaboozi ka kikulu aba omusajja oba mukyala, will not allow you to donate blood because you have risky behavior. Singa tukusanga nga okwesa ebiragalalagala, you're a drug addict, tesobola kukkiriza kudonate omusaayi kubanga you're high risk, your blood is high risk. Kati singa tukusanga nga gwe olinamu obulwadde nawe tetukuggyako omusaayi kubanga ate gwe tetwagala kukosa bulamu obwo. So it's both ways. Twagala omusaayi gwe gubenga mulungi, oli bulungi gwe mwenyi omusaayi gwe mulungi, ate twagala tukuggyeko omusaayi tubenga tukola ki tukosa bulamu. So we try to make sure that the donor is protected and eventually the recipient is also protected. So bwe tumala okusoloza omusaayi awo wewona tukusanze omusaayi tukukebera hepatitis B, hepatitis C, HIV ne syphilis. Then tukebera ne blood group. Tetutera kubiriza abantu kujja wano ku blood bank tetukeberawo abantu musaayi nedda. Era bw'ojja n'ogamba bannange blood bank mwine ebyuma birungi, nina kashiwa kange wano nakafunye njega kakebera kawuka kasirimu ndyoke nkaggyeko obulago. We don't offer such services. We don't offer such services. Tugamba nedda ffe tukebera omusaayi oguli ki oguli donated. N'omuntu bw'aba donatiza omusaayi, they can always come back and we give them their results. But we don't encourage people to donate. Kangenda donate bajja kunkeberera bwerere. But test tetukola singa ozibalabalamu mu ssente zibagenda mitwalo nga 12 nga kange nenfiseeko eri bankeberere bwerere. Nedda, we don't do that. We don't encourage that. We don't encourage that. So we do HIV testing, hepatitis B, hepatitis C, syphilis, and then we also do blood groups. And we have the best technologies in the country. We have the best technologies in the country for testing these diseases. Now, after we've tested the blood, what process does the blood go through? So we store the blood here. As a blood bank, we store the blood here. Amalwaliro ne gajja gakimwana omusaayi. Kati obuzibu bwe tufunye nti we have scenarios where we have good stock of blood here, but the blood is not in the hospitals. Era kituyisa bubi nnyo. Mulimu amalwaliro mangi nnyo ag'ebulankanya to come and pick blood. They don't want to incur that cost of coming to pick blood.
Bagala basooka bafune mulwadde.
Bali na basooka bafune emergency situation, and that's what we want to avoid. Banko yanga fala bobo libusia. Noma ngofunye omulwadde omukyala ali okubleedinga. Busia to Mbale is 1 hour and Mbale back to Busia is another. Those are 2 hours of time lost. But if you had picked your blood and stored it there, then that mother will be able to access it immediately. So what we are doing now is profile those health facilities that are having reluctance to pick blood. Now every health facility should plan to pick blood at least once every 2 weeks. But we can give you blood to take you for 2 weeks. But after 2 weeks, come back and teguna kolachi. So that every other time we have blood in the hospitals. Now another thing we are seeing is olumu omusayi mu ddwaliro naye ng'akola mu lab gye baterese omusaayi yagenze n'ekisumuzo kya fridge. Omusaayi teguliiwo lwaki? Omusawo yagenze n'ekisumuzo kya fridge oba ekya lab. So we have now taken our efforts now from the blood bank. Now do you know munji? That we are now going to health facilities to help systems to make sure that people can access the blood. So that is some of the efforts now we are putting energy into. The blood, when it is in the health facilities, it is also easily accessed, free, whether in private or public health facilities, accessed free in the health facilities. The other issue I want to add is that we want to appeal to organizations to have plans for their staff to donate blood. In especially njagala okwebaza abantu ba Jenga community outreach, Bali sides around. We have appointments with them throughout the year. They have decided that every year they will have 3 blood donation days. So we have planned for them. Tujja kujja mu December tujje na wano. So to serve, if other organizations can also adopt that and work with us, even if you're just 5 people who are going to routinely donate blood, we'll have with you appointments, we'll come with corporate branding, and we'll be able to reach out to you. So media houses donating during this period, and we have that. As a strategy, we have a sustained supply of blood. Now, from blood, we can give a patient blood, the whole of it. But we can also remove some products from the blood. Do you know what we call platelets and fresh frozen plasma? Biyambako abantu abalina bleeding disorders, or if somebody is bleeding too much. So to tegeeza abantu, the health workers who are out there, that we have capacity to provide you platelets and fresh frozen plasma. So you ask for these things as well. To be take, and they expire on our hands because you people are not asking for them. So I want to use this chance to inform the health workers out there that at Mbale Regional Blood Bank, we are able to prepare platelets and fresh frozen plasma and cryoprecipitate on demand. So if you have patients with bleeding disorders or patients who need platelets or fresh frozen plasma, please, you can pick them from us. We readily have these products available. So tukola daka. So tuna products zinji zetujja musaayi okulaba nga we efficiently use the blood. In a special way, njagala okwebaza abantu bonna who are involved in mobilizing blood donors, whether it's organizations or it is individuals. We really appreciate your efforts. Nyawo bategeeza okonvisinga omuntu atagabangako musaayi ogugaba for the first time is not a joke. Era for us tugamba nti mu bantu bwega nawe 10 abatagabangako musaayi, if you successfully convince one to donate, you have actually done very well. So we want to appeal to people who do blood donation mobilization. We thank them so much because they are helping us improve on our stock of blood.
Maybe nga bwe tuwumba abantu abalina private clinics.
Yes.
So that basobola okuba nabo ne drivers eza blood donations.
Yes. Now, first of all, even private clinics that want to start offering blood donation, blood transfusion services, we accredit them. If you have a private facility and you want to start offering blood transfusion services, we can accredit you because we believe blood should be readily available everywhere in the country, in any corner of the country, whether in a private setting or public setting. because you never know where you're going to need the blood from. So you want blood to be readily available everywhere. Now, with private health facilities, they need to get accredited by us. So what one nikira, and we go and inspect. Nerukakasa nti balina ebisaanizo ebyokuba n'omusaayi. Balina abasawo abakugu, balina fridge, balina storage for services, tebajja charginga, balina equipment that's testing omusaayi, and all those things we go and accredit. So we accredit private facilities. Anybody, anywhere who wants to mobilize blood donors is welcome. Anybody, anywhere. Whether political leaders, religious leaders, culture. We had successful campaigns in Kampala working with the Kabaka Foundation. Ngasaba sajja mwennyini yakolachi. Yakulembera okola batogaba omusaayi. We had successful campaigns ngakola ne ikomanya wa bugwerwa ne wayabire. Naye we've not had a lot of penetration with Inzuya Umuhuha because of the challenges they have had. But all cultural leaders can as well help us to mobilize blood. Anybody, anywhere, who can mobilize blood donors, we are happy to work with you.
Akatalekeka ngatumba. Mwene akatalekeka ngatumba umu.
Kwebaza. In a special way, kwebaza our blood donors. The best we can tell you is thank you, but you should know that the blood you donate saves lives. And the people who receive it are extremely very grateful. You have given many people a chance at life again because of the blood you donate. So please, keep donating your blood because your blood saves lives.
Maybe nature, you know, chibozo. Mulimu abantu agama ayinza okubeera from nowhere n'agamba nze ndi ready. Asobola okugenda mu ddwaliro ne muli okumpi n'agamba nze kudonatinga mu musaayi oba alina kulinda.
Nedda. Uganda Blood Transfusion Service, FEFECA in the country, are allowed to collect blood. This work of collecting blood is like a sub-specialization. Equipment is a fezanjaulo, the handling of blood is special, the storage is special. So anybody who wants to donate blood can not only do it at with our staff, with our structures. So we always share our programs in Antwatamulamu field. Now abantu who are near the regional blood bank can always come here and donate blood. During this school period, we are here 8 to 6 p.m. Monday to Friday. We don't work on Saturday and Sunday. Naye mu January and December, tukola 24/7. They say January, December, even if you came here at midnight, there will be people to receive blood from you. But as of now, because we have very good stock, we can reserve you adults for December and January. So that's why we're not so aggressive right now with the people out of school population. Yes.
Maybe pozi kusibula bantu.
So banange tweyanziza nnyo Mosan Media. Yep. Yes. Keep yourselves on Mosan Media. Like it, subscribe, repost, share. Ennimi za social media nyingi. But we have
Elgon Times Media.
Elgon Times Media as well. So please support these media houses because they are doing a lot of charitable work. But though I know they're going to give this information out, so please support them. But they're also supporting us reach out to the population out there.
Dr. Bumba Ahmed, gutubadde nayo nakolwaleero ngono manager wa Mbale Regional Blood Bank. Akumenyedde wajeekoma lwakuba nti ekyomukisa omulungi nti bagudde already at Muteso, that is Soroti, egenda kuyambako ku mirimu gyegimu egy'omusaayi naye nga nange nakwongerako eddoboozi tono nnyo ku nsonga y'okugaba omusaayi. Kino tokikola nti olina omuntu gw'osuubira owa agenda okugwa kabenje, wabula okikola olw'omuntu gw'otamanyi agenda okudda engulu olw'omusaayi gwewamuwa. So toteekawo nnyo bukwakkulizo ng'ogaba omusaayi gyate simanyanga swaki mugaba soda lwaki temutwa soda ne juice. Nedda, kikole ku lw'obulamu bw'omuntu omulala gw'otomanyi kubanga tomanya ne gw'oyinza kutaasa. Oyinza okutaasa omuntu aye naawe agenda okutaasa omwana wo oba omuzzukulu wo mu future. So kikole ku lw'obulungi bwo. Nze ndi omu ku bagabye omusaayi by the way, era nze ngugabira wano wennyini bwe ntudde Regional Blood Bank. Si mulundi gumu, seebiri, seesatu, emirundi egiwerako ddala, naye nga sisuubira kubaako na kyenfuna nga nze ogaba omusaayi. So naawe osobola okukikola nga omuntu omulala yenna n'ogaba omusaayi kubanga kiyinza obutayamba ggwe oba omwana oba nekiyamba omuntu fa relative gw'otomanyi na kumanya nti ya survivinga olw'omusaayi gwo. Until next time.